So now that we've talked about what's covered by Medicare, how it's covered, okay? We know what the gaps are. We know what your exposures are to what's not covered by Medicare and what the costs could be. Now we're gonna learn how we get rid of those costs. There's two ways to get rid of those costs, either with a Medicare Advantage plan or with a Medicare Supplement plan. I like to refer to this as good versus better. I think they're both great options. I just think one is a little bit better than the other one. It really just depends on what your individual needs are and what you want. We do offer both plans. Just really, again, it's a personal preference. Cost matters into, budgets matters into. So those are all things you want to take into effect. Again, these are all of the things that we can teach you in our one-on-one consultation that you can set up with us after this webinar. Now, I have an employer group plan that I provide to my employees. It is very expensive. There are big deductibles, big copays. I would take either of these options in a second. It just depends on, again, what your preference is. Now, a Medicare Advantage plan is a private plan that's going to replace your Medicare, okay? It's going to be available per the county that you live in. So the plans are gonna vary county by county. You're gonna need to use a network, okay? Except for emergency care, you can usually join either an HMO or a PPO type plan. Plans are gonna have a gatekeeper or require prior approvals for surgeries or for tests. If you need to get that knee surgery done, the Medicare Advantage plan might require you to do some PT prior to that surgery being approved. Now, a Medicare Supplement plan, now again, it's a private plan that you're going to carry in addition to Medicare. There's no network, it's nationwide coverage. You can use it wherever Medicare is accepted. There's 10 standardized plan options, and you never have any prior authorizations with the plan, okay? Whatever your doctor orders, you can go ahead and do. Now, back to the Advantage plan. Again, the Advantage plan typically going to have zero premium in addition to the Part B premium. We're going to continue paying that, but no additional premium after the fact. A Medicare Supplement plan is going to have a monthly premium in addition to the Part B premium, okay? Your Advantage plan, typically it's going to include your Part D prescription coverage. A supplement, you're going to need to add a standalone RX plan. Now, a Medicare Advantage plan in 2025 can have a $7,550 maximum out-of-pocket in-network and a $14,000 out-of-pocket maximum out-of-network, okay? A Medicare Supplement plan typically is going to cap your expenses as per your monthly premium that you're paying. You may have some copays and some deductibles to meet, but typically you pay that premium and you don't have very much expense above and beyond that premium. Now, a Medicare Advantage plan can add some additional benefits that original Medicare doesn't cover. Dental, vision, hearing, gym memberships, grocery cards, those all can be added to a Medicare Advantage plan. With a Medicare Supplement plan, you're not going to have those benefits. If you want to add the dental, the vision, those are going to be at additional cost on an optional basis to add to the plans. Some of the Medicare carriers that we represent here at Health Coverage Solutions, we represent all the major carriers. Here's a list of some of the major ones that we represent. Again, it's going to vary depending on where you live in the country. We will try and offer you the best plans that we can find. We're only going to use A+ carriers so that you can be secure that the coverage is what you need and secure. Medicare Supplement plans, plans A through N, okay? These are all the standardized Medicare Supplement plan options.